Hi everyone, I'm Sriteja and today I'm here with Dr. Priya Kumaravelu and we'll be learning about who she is as a doctor and what she does. So thank you so much Dr. Priya for coming here.
Hi.
So starting off with the first question, what specialty are you and what exactly do you do?
I'm a blood and cancer specialist. I take care of all kinds of blood disorders and all kinds of cancers.
I see. That's really interesting. So like what like cases do you typically come across like at the hospital or in your clinic?
Yeah, so in the hospital setting, I take care of patients who are very sick, along with other doctors. Patients can have low blood count, patients can have high blood counts, patients can have blood clots, or patients can have tumors that is causing trouble by compressing other organs. So we try to solve puzzles and help them get better. And then once they are more stable, I then follow up with them in the office setting as well.
I see. That's really interesting. So, Dr. Priya, why did you choose medicine as your career path?
I was fortunate enough to be raised by doctors. My parents are doctors. We own a hospital, so I grew up in a hospital environment. It was those days where doctors were not called providers and patients were not called as consumers. Our relationship was really good that my parents put their patients' life ahead of us, and in return they were respected very well, and even I got pampered by patients, family members and all that. So I got addicted to that attention I got.
Wow. Yeah, I know it's very different between like then and now. So
Yes.
yeah, that's really interesting actually. So Dr. Priya, why did you choose oncology as your medical specialty, and is there anything that inspires you about this field that like really fascinates you?
Yes, I actually wanted to be a cardiologist, and I had all my dreams and goals set towards cardiology. But what ended up happening was that my personality matched more with oncology. I'm very soft-spoken and compassionate. To be a cardiologist, you need to be a little bit more stronger emotion, I guess. And I lost both of my grandfathers to cancer, and I've seen their end of life really miserable. They were in India, so that's when I realized that death is inevitable for all of us, but at least I could do something to make their life easy in the process of dying, or in the last several years or months they got to live.
Wow, that's really inspiring and interesting as well. So, Dr. Priya, take me through your like daily routine as a doctor. So, what do you do like morning to night?
So, yeah, I start rounding in the hospital before I go to clinic. So that would be like 7:30 or in the morning. I leave, and till 9 I would be seeing all the patients in the hospital setting. These patients are very sick. I start rounding in the ICU setting, and I make sure all the patients are safe before I go to clinic, because it is very time sensitive when they're in the hospital setting. They need attention then and there. But in the clinic, it's more of an elective appointment base. So I actually review their records ahead of time and have a plan. And so that when I see the patient, I get time to spend time with them. I talk to them and clarify things in such a way that I put them in the driver's seat. So when they leave my office, they know what they're doing and why they're doing. And so I get to see both cancer and blood, both in the hospital setting and the clinic setting. In my clinic, I would say 40% cancer patients and 60% blood disorders. And of course, cancer patients consume more time and energy, but that's how it is.
So, what are blood patients, and can you like explain that a little bit because I don't really know what that is.
Sure. So blood is produced from bone marrow, and there are three kinds of blood cells: red blood cell, white blood cells, and platelets. platelets stop you from having bleeding. So when you bleed and bruise, you don't do anything. It can stop on its own, right? Most of the time. That's because of platelets. And red blood cells carry oxygen throughout the body. So white blood cells are like soldier cells, so they are needed for fighting infection. And amongst white blood cells, there are several kinds. Each one has its own job description too. Like neutrophils take care of bacteria, lymphocytes take care of viruses, and eosinophils are for allergy. So each one has its own job description. And so when you say blood disorder, these things can go wrong.
Okay.
If you have low blood red cells, then you don't have enough oxygen carrying capacity. If you have low platelets, then you can bleed. If you have too many platelets, then it can clog up and clot and cause strokes and heart attacks. White blood cells, if it's too low, then you don't have immunity to fight infection. So
Yeah. So like, can you give like a general gist of like what exactly do you do to help these blood patients?
So first we need to find out why they have it. Then you can fix it. So usually I divide all blood disorders into two categories. One is cancer and non-cancer. So I try to rule out any reversible causes and fix it. If it's irreversible or if it's cancer, then the treatment is entirely different. If it's irreversible, then I see if it's causing harm or is it just there but it's not hurting them. If it's not hurting them and it's abnormal, I just watch them periodically. If it's causing problem, then you treat it. For example, if they have low platelets and they are at risk of bleeding, then that could be because they are producing enough platelets, but it's getting destroyed by your own immune cells. Then you control the immunity to make sure the platelets live longer. Or if they have low platelets because they have an infection that's causing destruction, then you give medications to boost up the platelet count. Some patients, if they drink and destroy their liver, healthy liver is needed to produce platelets, and in those cases it gets harder. We may end up having to transfuse them, but it's not long-term or sustainable at that point.
That's interesting. So like, on the other hand, let's say you see a cancer patient. So
Yes.
what do you exactly do to treat them?
Yeah, so cancer patients, we first have to diagnose them, right? So cancer is a common term, but it could be any part of your body, and each organ has its own function. So and each cancer has its own personality. So you can't use treatment for one cancer to another cancer. Lung cancer is very different from skin cancer. That's why when you say we're going to cure cancer, like what cancer are we talking about? We need to first find out what cancer. And pancreatic cancer is very aggressive compared to prostate cancer. So each cancer you have to go based on their nature, and then you have to stage them too. Stage 1 through 4. 4 is not curable. The goal of treatment in stage 4 is to prolong survival and relieve their suffering and give better quality of life. And stage 1 through 3, you try to cure them. And medical oncologists are usually part of treatment from stage 1 through 4.
I see.
And stage 1, we try to see if we can operate and get rid of it, and plus or minus chemo to decrease the risk of it coming back. And stage 4 is usually chemo or chemo-like treatment given through the vein or through mouth so that it covers the entire body. And stage 2 and 3, if it's not operable, then based on what kind of cancer, we do chemo along with radiation.
I see. That's really interesting. So, Dr. Priya, I know you're a doctor, and I know you're really proud of being a doctor. So, what are the most satisfying parts of your job?
Well, I get to sleep peacefully. I get to be treated like family. In addition to that, I get to solve puzzles that keeps me going. Especially blood disorders are like solving puzzles, and yeah.
So like say helping people and becoming like a part of their lives
Yeah,
directly.
they treat you like one, and it's very rewarding. Yeah.
Yeah. So like switching from like positives to negatives here, like what are some challenging aspects of your job?
Yeah, the reason they treat you like family is because you behave like one, right? So you are going to put them ahead of your own family sometimes, right? Actually, most of the time, because they come first, and it's somebody else's life, so we can't play with it, right? We have to be very careful. Any decision you make on their behalf is going to be having an impact on them. So you have to, it doesn't matter it's day or night, you have to be available for them. And basic needs like food and sleep will be compromised. In our profession, like any other public servant, you have to be there for them. But ours is a little bit more complex in the sense, if somebody goes to war, in a soldier going to war, and if he dies, yes, the family loses him, and it's a very sad thing. But if a doctor goes to work and catches an infection, I mean, we can have needle stick injury where we can catch viruses that can be life-changing or life-threatening. We can have catch COVID, and then we come home and we can spread it to family members too. So we are risking our entire family to some extent. But I still will do it.
Yeah. So what is like the biggest piece of advice you would give to someone who is aspiring to be a doctor or maybe wants to go into oncology maybe?
Yes. I really love my profession, and I have no second thoughts about why I am in this profession. But if somebody has to come into this profession, they also have to have the same mindset. If you don't have passion, this is not for you. It's like I said, you're going to sacrifice food, you're going to sacrifice sleep. You may not get to go to toilet on time. That's not something most people are willing to compromise on. Yes, we do get paid well and respected well, but there are so many other professions. If money is all you're here, if someone is here for, then they're making wrong decisions. And especially in our profession, the training is it's a very lengthy journey. Pre-med is 4 years and med school is 4 years, and then you have to do residency. Most of the time you end up doing fellowship, right? So I had since I did my med school in India, it was 5.5 years of training there, and 3 years of residency, and then 3 years of fellowship. That's like nearly 12 years of my prime time.
Wow.
Right. If you go to other professions, in 3 to 4 years after you're done with your college, you may start earning money. So you may get emotionally disturbed seeing your friends who went to other professions start earning early, and unless you are passionate, it's going to hurt you. If you're passionate, nothing matters. You will keep going.
Yeah, I think that's super interesting and important detail to note, that like you have to do a lot of hard work to become a doctor. Yeah.
And we have something called CME, which is ongoing medical education, and our license would expire periodically. We have to recertify every couple of years to 10 years, because there's so many new things coming every day, and we cannot say I do not know.
Yeah. Because there's like so many more
so many new things,
so,
and
like,
people say science is the best thing because it's all evidence based, but funny fact about science is it keeps changing every day.
Yeah, super. That's also another interesting point to note. So, Dr. Priya, a fun question here.
Yeah.
If you hadn't chose medicine as your career path, what would you have chose instead?
I would have been a lawyer.
Why would you have been a lawyer?
When I was a kid, this is what my dad used to say. It was hard to argue with me, and I would always win. And I don't do that anymore. But I am all about doing the right thing, and so I would fight for ethics and dharma. Maybe, sure. things have changed. Just like how our profession was not provider and consumers, things have changed in our profession too. So, in general, the world has changed. But had the world been the same and I didn't go into medicine, I would have been a lawyer.
Yeah. Well, speaking about like the world changing and all that, like so artificial intelligence, you definitely know is like super big nowadays, and it's like such a rising industry today, especially in like the medical field. So what opinions do you have on like artificial intelligence like taking over the jobs of doctors, or even like helping doctors with certain tools and technologies? So what do you think about that?
I was asked the same question a couple of years ago by one of the CEOs in a hospital, and I told him the day when parents get replaced by children is when AI would replace doctors. What I mean by that is you cannot replace doctors. Our brain is way more faster than a computer's brain, and it's a human who designs the AI, correct? And it comes with its own flaws, and you need a human to fix the flaws too. It may be, unlike other profession, medicine is not black and white, lot of gray zone, and that's where your experience and your intellect come into act. So you can, it's not like 1 + 1 is 2, so I can have in a computer take care of it. It cannot. We may use it for some simple things to help doctors, but it cannot replace doctors. That's my because that's my thought. My son wanted to be an AI engineer as well, and now he has completely switched gear to applying for pre-med for the same reason that I just told you. I don't think doctors can be replaced.
Yeah. So like in 5 to 10 years, like you won't see like robots or like artificial intelligence systems like solving cancer or doing all that?
No, what will happen is they may try doing, not specifically for cancer, in general, they may experiment with it and they will understand. It's like nuclear bomb, right? There are plus points and negative points. So unlike other profession, medical profession, you can afford to make mistakes. You cannot do that. So when things go wrong, it'll be a big problem, and it'll be a dead end for AI at that point. You can use it to make doctors' life easier, but you cannot use it to replace a doctor, because you will reach a point where there will be error that you will be risking a human's life, and once that mistake happens, people will realize where they went wrong. And
so, Dr. Priya, coming from like an oncologist, is there anything that we can do as humans to prevent cancer, or like to help us like not get it in the future?
Yeah. So not all cancers are controllable. 15% of the cancers are because of genes that you carry, and 85% of cancers are from environmental factors. And in that 85% of cancers, there are two major categories that I think we can work on. One would be viruses-induced cancers like HIV, hepatitis, herpes. These viruses can cause cancer, so we have vaccinations to prevent the spread of these viruses. And when it comes to other environmental factors, we have smoking. Smoking causes cancers all the way from lip, tongue, throat, lungs, bladder, and of course alcohol. Alcohol causes liver cancer and stomach cancer, esophageal cancer. And then pollution. So these things, you have control over. So you shouldn't be poisoning yourself. And then when it comes to certain cancers, there are screening available. Screening means you're looking for cancer before the symptom begins. We have colon cancer screening with colonoscopy. We have breast cancer screening with mammogram. So if somebody was smoker for a long time, then they can get CAT scan every year looking for cancer, because if the cancer is very early stage, then we can cure them as soon as we find them.
Yeah. So, Dr. Priya, let's say like a patient comes in with some sort of pain, but they don't know like what exactly it is. So, how do you diagnose them and like take me to the steps of like what happens?
Yes. So let's go with the hypothetical situation where somebody has abdominal pain and they have constipation and they have some blood and stool. These are symptoms that has already began in cancers like either colon cancer or stomach cancer. Based on how sick they are, sometimes they are so sick that they've been bleeding so much that they are so tired and in pain they end up in the emergency room, and that's when they get scanned. We see tumors, and sometimes we may have to do procedures called EGD colonoscopy, where using a probe with a camera, we go into the colon or stomach based on where it started. We look for sources of problems and biopsy them to confirm if it's cancer. Sometimes the tumors are so big, and by the time we find out it's late, it can cause complete obstruction where the bowel movement doesn't happen, and then even perforation can happen in those cases, and they need to be taken to surgery right away to get rid of the bad stuff and connect the healthy gut together. And then once they stabilize, then we talk about chemotherapy. Once they heal and start eating and become stronger, we start treating them with chemotherapy if cancer confirmed.
So, Dr. Priya, like speaking on the topic of technology, are there any like cutting edge cancer technologies that you have seen or used?
Being a chemotherapy specialist, a medical oncologist, I do not use technology, but I do know what happens inside the cell and how the cell divides and what goes on in their mind. And so we oncologists make use of that and try to treat them. In those days, all patients with cancer, medical oncologists treated them with chemotherapy. Chemotherapy is given through the vein, and it's extremely toxic. Because you're literally killing cancer cells, but cancer cells are our own body cells, which means the bystander normal healthy cell can be destroyed as well, and there will be damage done to other organs. Like sometimes people can have nerve damage, sometimes people lose hair, sometimes people throw up all the time, can have mouth sores and fevers and infections and whatnot. But lately, since we have learned that there are other mechanisms by which we can attack cancer cells, we sometimes do gene sequencing to see where mistake happened and if there are any mutations, which are basically mistakes in the cell division process, right? If they can be attacked by pill-based treatment. So it's like, diabetic patients taking pills. These cancer patients are taking pills at home, so they won't have to go to infusion center for chemo through the vein. They may not have the same side effect as losing hair, nerve damage, or throwing up and being very sick, but they may have other side effects sometimes like diarrhea and skin rashes, but that's very much manageable. And any medication for that matter has its own side effect, but we look at the risk and benefit. Since the benefit is way higher than the risk, we use it. And then we also learned that we all have immune system that attacks the not just bacteria and virus, but also any young new cancer cells that are being formed. And cancer cells then try to evade our immune surveillance and escape and form family. And so we learned that, and so we are going back and educating the immune system to say, hey, you're supposed to kill them, go back and attack. So we re-educate immune system. So when we use immunotherapy, it's usually through the vein as well. It does not have chemo side effects, so they don't lose hair, throwing up and feeling sick and all that. Very rarely it can cause inflammation because of too much immunity attacking certain organs, but in general it's very well tolerated by patients. So immunotherapy and targeted mutation-based therapy and monoclonal antibodies have revolutionized cancer treatment.
Wow, that's really interesting too. So that was today's interview, guys. Thank you so much, Dr. Priya, for coming here and doing the interview. I learned a lot, and I'm sure like all the viewers have learned a lot too. So comment down below what's the biggest thing that you've learned, and be sure to like, comment, and subscribe. Thank you. Bye.
Bye. It was a pleasure being here with you all. And yeah, any questions you have, you can ask Sri Teja, and I'm more than happy to answer on his behalf.
Yep, sounds good.